Hello, and welcome to Level 4 Diploma in Health and Social Care. We're looking at the Managing People unit, Unit 405. And this is week 2. And in week 2, we're focusing on team development and some types of teams. Okay, let's have a look at the objectives. We're going to be looking at 2.1, where you have to explain the process of team development, and I'm going to talk you through that in a minute. And then we're going to look at 2.2, which is the different types of teams found in health and social care. Okay, so it's different types of teams in all sorts of organizations, but for this tutorial, we're going to focus on health and social care because that's what you need to focus on for your assignment. Right, team development. To be an effective team, you've got to be able to work together. You've got to work for the good of the team and aim together to achieve the team outcomes. But it doesn't really happen automatically. In fact, the more you work together, the more it tends to develop. So if you think back to maybe when you were at school or at college, you might have had an experience where you've put on a small group team to work on a project or a little assignment. And when you get together, as I've written here, you probably sit around and look at each other, and you don't know to start. You don't know maybe who's going to start. You might not know each other very well, so you don't know what people's characters are like. Who's going to take the leadership? And you spend a bit of time working together, and it's a sort of fairly awkward. But you get to know each other, and the more you get to know each other, the more you know what to expect from each other. You know who's good at what, and you can divide up the labour better. Like, I mean, she's really good at research. He's good at actually creating graphics and things like that. So you work out how to coordinate the work in the best way as well. So, and this process that you're going through is about yourselves trying to learning to operate as a team rather than just as an individual, really. So we have the stages of team development. And they're pretty set. And this is a well-known piece of research by an educational psychologist called Bruce Tuckman. And he identified a 5-stage development. He, in fact, identified for a long time he ran with a 4-stage development. And then he added the 5th stage a little bit later on. So you can see from the graphic, it's got a little bit of a wave action, really. And that's really sort of, it's got highs and lows, and they're usually the progress of team effectiveness. So as you can see, the vertical line is team effectiveness, the horizontal line is time. So hopefully you get more effective as a team the longer you work together, if you look at our graphic, apart from the fact that you have a bit of a dip in effectiveness during the storming phase. And I'm going to tell you a little bit about those different phases. So there, as I said, originally there were 4 phases: forming, storming, norming, and performing. And then finally, Tuckman added adjourning. And that's really, I'm going to tell you about that a bit more later on, but that's really mainly for project groups. So your team may just have just the 4 phases. So we'll have a look at that. Okay, so phase 1 is the forming phase. And this is the getting to know you, getting acquainted. People are a bit uncertain of, you know, who's who. If you're lucky, you might have worked together, or they might be your classmates, so you might know a little bit about them. But they could also be people from another class or another group that you don't know so well. So you're a bit uncertain, and people are looking for leadership. And during this forming time, somebody tends to take charge, really, or a couple of people tend to take charge a bit. And some people will take charge in a very definite way. Other one, it might be a sort of slightly more democratic way. Um, But however it is, there's usually someone who starts saying, well, okay, who's going to do what, and starts to take a little bit of a leadership role. And during this time, you're sort of asking these questions about, will I be good enough? Will I fit in? What do they want me to do? Will I be able to do it? So it's a bit of an uncertain time for most people, even that person who starts to take a little bit of leadership. And most of the interactions in the forming bit are social, when people are getting to know each other. And they don't get a lot of work done really, but it's really important. You just can't launch into it really. And that's the time when you might sort of start, throwing around the ideas for how you're going to go about your project, because that's a good time for, when you haven't really settled down, it's a good time to sort of come up with different ideas. And you can find out, because you're all different types of people, you might want to do it in different ways as well. And you can find out about that too. And maybe you might agree on a sort of an approach. Okay, so that's the forming stage. The next stage is storming, and this is quite a difficult stage, and it's an uncomfortable stage for those of us who have been through it. It's quite critical, and it's you've got to sort of grit your teeth and get through it really a little bit. Um, it's marked by a lot of conflict and competition, and this is where people are comfortable enough in the group to start letting maybe their real personalities come out. And sometimes they can be horrid, and sometimes they can be lovely, or sometimes they can just really, really hard work. Okay, so this is a time when your performance decreases because your energy goes into a lot of side arguments really, and it's more about personalities clashing or asserting themselves rather than it is about the actual, what's down on the paper and the work that we're doing. So you may disagree on the goals, or you may disagree on how to meet the goals. But what happens is this is when you're sort of subgroups, if it's a big team, or just cliques, like him and her, they get together and sort of pick on him and her because they disagree with each other. As you can see from my graphic, they're trying to murder each other there. It's not always that aggressive, but it can be a real problem. And to get through this stage, members have to work together to overcome the obstacles. They've got to listen to each other as well, and sort of try and settle their conflicting ideas one way or the other, even if it means someone sulking for a while or someone storming off and maybe coming back later on. Or maybe not, maybe leaving the group forever, who knows. Teams can get really bogged down in this time, as I've said. And if you don't address these conflicts, you're going to have a long term problem in the team. You're going to have someone who refuses to work. Now, we've probably all been in that situation where, and if you're lucky, you can maybe get them reassigned. If it's a work group, you can go and say, look, we're all working quite well, apart from Harry, who really just doesn't like the way we're doing it, but everybody else is in agreement. So we're actually starting to get some constructive work done. But Harry's quite destructive, and maybe a manager will remove them. When you're doing school or college groups, sometimes you don't have any choice, but to just put up with the person. And sometimes they'll sit quietly in the corner, and if you're lucky, they'll say nothing. It won't be a very constructive experience for them, but in the end you will go ahead and do what you need to get done. So it will sort itself out, but it can be an unpleasant time. Norming. If you get through the storming stage and don't completely dissolve, hopefully you've resolved your conflicts and you get some degree of unity. And this is the norming stage, when you start to develop consensus, you start to come to agreements about who's taking what role, who may be the leader or leaders, and hopefully you'll solve these interpersonal differences. Like that person might storm off and never come back, like I said, or they might ask to get assigned elsewhere, or they might just sort of get over it and sort of say, okay, yeah, all right, I'm going to do it your way. Or they might say to you, but don't blame me if it all goes wrong, because that's what people usually say. But there's some sort of sense of cohesion and unity. And you start to create your norms for your group about what is acceptable, what is it you want to do, and what's the acceptable way of doing it. It's all about creating agreements and consensus, really. But you can start focusing on what the goals are. So this is the beginning of really, really working together. It might be a little bit stumbly at the beginning, but this is when you're starting to work together. And you sort of decide what the parameters are for your group, or what you think is acceptable. And you start trying to do some problem solving together. And sort of the more you do it, the more you realize that you get better at it as a group, or you get quicker at it. And that's got a lot of positives too. We look at a little bit more about norms a bit later on. Okay, now the final one, the important one, is performing. Okay, if you see the graphic, it's actually getting to achieve your goals. And consensus and cooperation have been well established. So the team is working very, very well together. It's mature, it's organized, and it's functioning well. So this is probably when you're doing your best work as a team. The structure is very clear. Everybody knows who they are. Everybody knows what their role is, and people are committed to the outcomes and the goals. You still will have some problems and conflict because people are people, but you tend to deal with it constructively, or maybe someone's in a leadership role that actually takes final decisions. But it's very much, this is very much a getting on with it, happy getting on with it, really. So this is probably, if you've worked in it when your teams at a performing level, these are the ones when you reflect on when you leave a job, maybe for a good reason, maybe for promotion, and you look back and you think, yeah, that teamwork, yeah, I really like doing that job. That's when you're in your performing stage. Now, the final one is adjourning, and as I said, it could be an ongoing team that just remains in the performing stage. Say you're a care home, and you started afresh together as a team, and you're just carrying on running a care home. You might not have an adjourning stage. You might not stop, because you might all want to sort of, you will carry on and just keep making the home better and better. But the adjourning stage is often for maybe shorter project groups, or a group that might have a set end. It might be a 3-month group to look at something, or 3-month group to look at one particular goal. So the adjourning stage is what happens when your work is over, really. Hopefully your goals have been accomplished, and the emphasis of the team is like wrapping things up, doing the last bits and pieces, getting all your documentation done, maybe writing up a report for the results. So the workload has gone down, and some members may start to drift away because they may be asked to go and do something else, or they may go back to their normal day-to-day work, and the team is in a disbanding sort of mode. You see in my graphic, you know, um, I've got a party picture here, really, because generally it's quite nice to celebrate an achievement. So when a team has finished a piece of work and you've actually achieved your goals, why not have a party, really? There may be some regrets. People might have really enjoyed working with someone, so there might be a bit of sadness about it. So there are some emotions to deal with, really. So, like I said, a ceremonial acknowledgement is always nice if your organisation does that, or maybe you just all go out for a drink together and sort of congratulate each other. Um, if it's an ongoing team, like a committee, that they might do some projects with bring people in to do it, and then they might go and do another project. So they might have different members all the time. They might have a few regular members, but new people sort of coming in and out. If the members are being replaced, you may go back. If a few members are being replaced, you could easily go back to the forming stage. And this is also if you lose a lot of staff in a regular team at once, or if people sort of move over a couple of weeks, you lose, like nearly 50% of your staff. You'd probably definitely go back to the forming stage where you're getting to know people again. And unfortunately, you might also go through the storming stage again before you get people up to the norming and performing, really. Um, if it's just one new person, it'll be a forming stage for them, but it might move quite quickly. If they're moving into a sort of fairly cohesive team, they might be able to join in and not go through all these steps, unless they're a bit, unless they're quite outspoken, and then they might go through the storming phase. So they might have the phases, and in a way, depending on how strong they are, depends on how much it affects the team. So sometimes the team might stay up performing and maybe absorb the one person who's getting to know them if they're really, really working well. On the other hand, if the person's a very strong person, that they could actually dismantle the whole thing and take the whole team back as well. So just something to think about, really. A little bit more on team norms. I mentioned the norming phase. What are norms? They're a sociological sort of view of the world, really. And in this case, we're talking about norms in a team. So when you've been on a team, how did you know how to act? How do you know what behaviour was acceptable, and what level of performance is required? So the team tends to develop local norms, and they usually think about the same as the normal norms from general work behaviour. They wouldn't really have anything that unusual, but they would reflect general work behaviour. But there may be some very specific ones for the team, like we don't discuss something outside. We only, anything we discuss as a team stays in the team, really, or with our team manager. But we don't talk about it until we've finished a goal. We don't really talk about it with other people. That could be a norm. How do we decide what the next step's going to be? You might create a norm that you all take a vote on something. If you've got a few different views, you might have a very democratic way of doing it, taking a vote. Or you might decide, you might have elected a team leader and you might give them the chance to to make a final decision. So you would create the norms within your team, and they do set a standard for behavior. You might have a thing that if people start arguing, that you end the session for the day and go home. That might be a sort of norm that you've created. They're sort of like rules, but they're not written down. But people sort of just learn to understand them, sort of by osmosis. Really, you just absorb it, really. So they're really effective in controlling behaviour, as long as they are all accepted by all the team members, and the level of cohesiveness decides whether everybody actually does accept it. So yeah. So we're going to sort of move on now, really, to look at types of teams. So types of teams. One of the ones you hear a lot about is a multidisciplinary team. It refers to usually a group of professionals. It could be doctors, nurses, therapists, social workers, etc. And they get together to provide a care plan, and a care pathway for a patient, and together they collaborate, and sort of make decisions based on their unique expertise. What you might find out is, say, imagine if you attend a mental health day hospital, and you're on the books of the day hospital, and after you've had maybe a clinic with a consultant, they might get together as a multidisciplinary team and discuss your case. And people with a different expertise will come at it with a different view. So the social worker might say, these are the things I need to do. The nurse might say, okay, I need to go and monitor their medication. The consultant might say, I've made a change to the medication. Can you monitor it? And so on and so forth. So they share knowledge and responsibilities, but they tend to act on their own and then come back together. So in multidisciplinary teams, they tend to write their own notes. So there'll be the nursing notes, the social work notes, the consultant's notes. And although everyone can have access to them, they will be written separately, and people will go and do their own piece of work and they will come back and sort of feedback to the team. Now, on Wednesday, I did this with Mrs. Jones. This is where we are now. There are other types of healthcare teams that have sort of been based on multidisciplinary team, but they've actually sort of moved on from it, really. And they include something known as interdisciplinary team, which is sort of a step up from a multidisciplinary team, where they share more knowledge and more responsibilities across the disciplines. So you might find that in the interdisciplinary team, say like the consultant and the social worker might go and do an assessment together. It will be a shared approach, and there'll be one sort of report, one set of notes that they'll both agree on, and then they'll sort of bring other people into it. So they tend to mix the responsibilities a little bit more, and they become a little bit more interchangeable. So it's not just the nurse who has to monitor Fred's medication. Um, if the social worker is going to see him, he might be asked to monitor his medication on Wednesday. So right, I'm going out there on Wednesday. I'll monitor his medication. I'll tell him to come to a clinic thing, and I'll do some work planning, job coaching with them. So they will merge their skills. What comes out of that is people get a bit more knowledgeable about the other person's role and abilities and the skills required for their jobs. And as I said, they become a little bit more interchangeable. The third level is like an even bigger step again, known as transdisciplinary teams. You don't see a lot of these really, but some sort of quite forward-thinking organisations do them. They go even further by blurring the professional boundaries completely to have a more integrated role in patient care. And in fact, they may have a sort of a service user on a team group to actually feed back on things, or the service user will be more part of the team. So they might do the actual care planning for the service user with the service user, and they might be sort of a large part of the decision making process. But people will learn, they become quite skilled in each other's jobs, and they can pretty much cover for each other, up to the point that legislation allows them not to. So key points of multidisciplinary team is diverse expertise. People come from various healthcare backgrounds, so you get quite a nice holistic view of the patient's needs. It's not just a medical approach, there's a social approach. You might have a psychologist who's looking at the psychosocial sort of approach. Collaborative decision making, they usually have a team meeting where they look at different cases and they make the decisions together, hopefully. Some MDTs, the consultants do try to pull rank a little bit. The successful ones grow out of that, the unsuccessful ones get a bit stuck in it. But generally, collaborative decision making, you're bringing your collective knowledge to make a good informed decision. And improved patients' outcomes, because so many different perspectives can lead you to hopefully have considered all aspects. So you don't discharge someone without thinking about how are they going to manage at home? Because the social workers have already said, hang on a minute, the benefits are here. We've had an OT in to do the stairs, that sort of thing. So some really good points about an MDT, rather than working in silos and not talking to each other. So as the other teams I mentioned, very similar to an MDT, both of them have emphasis on more actively sharing knowledge, more actively sharing responsibilities, and working together on tasks. And both of these have proved to be extremely positive. You can find some pieces of research about them. It's quite easy to find, but they have proved to be very positive. So it seems that the more the team share knowledge, learn each other's knowledge and share responsibilities, often the more effective they can be. Other healthcare teams. So we've got the multidisciplinary team, which can be in any area really. It can be in a GP surgery, it can be in hospital environment, it can be in a community resource. So what other types of teams are there? So I've also broken it up maybe into sort of 3 different directions really. So a common healthcare team is a primary care team, which is a core group of people who work in a primary care setting. That's usually sort of, GPs and around, and it includes GPs, nurses, and practice nurses, and they provide preventative and basic healthcare. So usually work out of GP surgery. Practice nurses do things like blood tests, blood pressure checks, asthma clinics, all those sorts of things which take time away from the GP really. Nurses might provide vaccinations, they might provide uh, long-acting medication. Some nurses are practitioners for some regular drugs, but also they do things like working with children, working with babies, newborns, providing the sort of child clinics that are needed as well. Moving up from primary care, you have a specialty care team, which is generally hospital based. And they would work around a medical speciality. So whereas the primary care team does anything and everything, because it's first point of call with illness, the specialty care team is where you might be referred to, and they would work with sort of specialities such as oncology, cancer work, cardiology, heart failure, or neurology, to do with the brain. And they're often comprised of sort of specialist consultants and registrars, nurses, and allied health professionals such as physiotherapists, occupational therapists, radiographers, and there will be a particular team. So if you're being dealt with for breast cancer, there'll be a breast cancer centre probably, and all the people who work in it, that is their focus. And because they're specialized, it makes them very knowledgeable in the area, which is what people often look for when they're actually being treated for something very specific like that. So there'll be lots of specialty care teams coming out, well, in a hospital. As I said, oncology, cardiology, neurology, radiology, are the most important ones really, or the most well known. Finally, you have a critical care team, which is a very highly specialized team, even more. They work in an intensive care unit, doctors, nurses, respiratory therapists, pharmacists, and they all provide intensive monitoring and treatment for very ill patients. Now, the patients, they could have different reasons why they're there. Could have been from a road traffic accident to a stroke to a heart attack, to being, someone attempting to kill somebody. I mean, there could be any reason for it. So they do need to have a wide range of care, but they're very focused on dealing with people who are critically ill. And when people are critically ill, there are a lot of similarities. It's about keeping people alive, trying to find out causes very often, and putting in the correct therapies that will actually bring people back to a different level. Once they are weller, they will move down into a normal care ward, but they're usually people who are going to be in hospital for a while. Um, if it's from, they usually go from accident and emergency into critical care team, and then back to a normal ward. So surgical ward, or a medical ward if they've had respiratory failure or something like that, and then they'd have the longer treatment. So critical care team, people are with them for a short while, hopefully, unless they're in a coma, and then they're with them for quite a while. If people have major surgery, like a transplant or a bypass, they'll go into critical care for a day or two until all their obs are stabilised, and then they'll move out to a specific cardiac unit, which just keeps an eye on them until they're well enough to go home. Okay, so 3 different types of teams with different drivers behind them. Okay. So that's really all there is on teams. I've just put a little reference for Tuckman, Bruce Tuckman, because it's worth knowing. He gets used in all sorts of things. It will come up in other of your units. So it's worth making yourself familiar with them. Do a little bit more research on types of teams, team development, because you will need some examples, really. You've got to discuss the different types of team, but if you can throw up some nice examples, it would be quite good. Don't forget to reference them. And also, there's a research document that I've put into your resources called Working as a Team, and it covers all aspects. It's about a piece of research in healthcare. It covers the development process of a team, and then it talks about some of the different types of teams in care. So you can actually bring that together. You can pick some examples out of there, or you can make some quotes from out of there if you want, in preparation for your assignment. Okay, so that's week 2 finished, and I will see you for week 3. Thank you.